Pleased to introduce our next speaker, Dr. Lori Moore-Merrell, who currently serves as President and CEO of the International Public Safety Data Institute. Lori began this role in 2019 after serving 26 years as a senior executive for the International Association of Firefighters, where she was responsible for a lot, including frontline interaction with elected officials, executive board members, state, provincial, and local chapter leaders. I think there's a whole nother page of all the stuff that Lori did when she was IFF. And many of you know how instrumental she was when she was with the IFF. Lori, along with a group of fire service leaders, founded IAPSDI a few years ago to assure that every local public safety agency can show their response capability, reliability, and operational performance using their own data. Today, she's going to talk about how national fire service organizations have been instrumental in the passage of state laws with the intended purpose to remove the burden of proof for firefighters with cancer, as we talk about presumptive cancer. National advocacy has also resulted in the legislating with the National Firefighter Cancer Registry, which we just heard about. And these efforts are certainly intended to protect firefighters and advance research to stop firefighter cancer. There is a common link to both efforts being successful, and that's firefighter exposure tracking. It is imperative that fire service leaders understand the need for individual firefighter exposure tracking and data contribution to research. Please join us in welcoming Dr. Lori Moore-Merrell.
Would it be all right if I use one of these? Perfect. Do I have to do anything? No? Oh, fantastic. Thank you. I'm your first real human today, right? So I'm really excited to be able to be here with you and to spend some time. And let me just start by saying hello from Pat Morrison. Many of you know Pat Morrison from the IFF, and Pat sends his regards. Normally he would be here in person, had hoped to be, but he is actually undergoing his last round of chemo this week. And so I talked to him just a few minutes ago, actually. He sounded really good, but he's sick. He's going to get his pump out this afternoon. So he's looking forward to a night's sleep without hearing the pump. So any of you who are cancer survivors, I'm sure you recognize that. So Pat does send his regards, and I'm sure you will give him a quick prayer or a good thought along the way. So let's go ahead and jump into our topic today. And as Ed said, we're going to talk a little bit about cancer presumption. But just the statistics, the IFF still looking at up to 67% of the names they put on the wall being cancer deaths. So reported from 2002 to 2020, this has gone up just a percent. It was 66%. After we added in the 2020, then it has gone up even a percentage. So larger than all other deaths reported, all other reasons for deaths, right? And so we are still looking at cancer being the number one killer of firefighters. We have to keep this in front of not only ourselves, but of decision makers. We have to do better. And so looking at that situation, then you know that we've worked for many, many years to pass presumption laws in every state, almost every state, where we have presumption for firefighters, connecting you, right? Connecting any kind of cancer or some kinds of cancers or one kinds of cancer depends on what state you're in, what the law actually says. And so that's why I want to share with you today, because we talk in generalities about presumptive laws, but they're not all the same, and they're not carte blanche presumption. And so it's important that we understand this. So we do have some that just have benefit eligibility. We still have a couple states with no presumption at all. We have had some movement in New Jersey and Colorado adding different types of cancers. So Colorado recently adding breast cancer. We've also had a recent movement in Arizona where they have removed some of the burden of proof. And I'll talk to you about that specificity in just a little bit, because it may be a lesson for other states as well. So let's talk about presumption a little bit, because often when we hear the word presumption, you get, okay, it's presumed. We have this carte blanche situation in our state law, and that's simply not the case. So let's kind of talk through what presumption means. Obviously, it somehow links a particular disease to an occupation, okay? It is presumed that if you get cancer, it came, and you're a firefighter, it came from the job, right? And that's what we all have in our minds. That's when we fight to pass these laws, that's what we're trying to pass, right? Is that kind of linkage that comes, and it would be a condition of your employment. But there are requirements in each of these laws that make them less than carte blanche, okay? So we have to still meet the requirements of the law. So initially, the burden of proof is removed for the firefighter. It is truly presumed, right, that it came from the job. There is initially no level of proof from the firefighter, but these other requirements for the law, and if you look at the last bullet, you'll see a couple of these. Sometimes there are years of service associated. So you must have been on the job for at least 5 years or 10 years, and the laws will vary. Maybe no smoking in your history is a requirement, whatever the particular states require. But every state has some sort of exposure requirement, right? You still have to show some sort of evidence that you ever went on a fire call where there was actual fire. Something was burning, right? So this is where we get into the details of following the requirements of the law. Now, why is that important? Because in every case, a presumption can be rebutted, okay? This again is what makes them not carte blanche. And they can be rebutted by anybody in the string, from your workers' comp, from the city or county itself, if you're retired, from your pension board, if you have pension healthcare retirees as retirees. So there's all kinds of places and opportunities for this kind of rebuttal. So what happens then if there is a rebuttal, okay, that does not guarantee your approval of the claim? And if you're anybody in here from Arizona, you've lived with this for some time. Insurance companies can rebut it. So this on-duty, disabilities from cancer, these sorts of things, all of these reasons to challenge a claim. And so what happens then is that the burden of proof can shift. Where I said to you earlier, the burden of proof initially, there isn't a level of burden of proof for the firefighter. But if it's rebutted, that can shift. And if that rebuttal shifts, or the burden of proof shifts, you can have two different thresholds. The first would be the preponderance of evidence. You have to show enough evidence to show the linkage, right, with the job. Your cancer is linked to the job. That's about a 50th percentile, the preponderance of evidence, burden of proof. If your law says clear and convincing, that's about a 90th percentile or 95, 99 percentile burden of proof, right? Clear and convincing is a direct link. Well, what does that mean? So when we get these rebuttals, we shift the burden of proof, then the counter arguments can become much more difficult. At that point, there is a 3-part test, and the 3 parts is exactly why we passed the law in the first place, right? You have to show an injury or illness has occurred. You have to show that it occurred while you were working, and the link between the two, which means evidence of exposure. Is that making sense? All right. So the exposure requirements then can vary within the laws, and they do. Every state law has its own exposure requirements. And so I'll give you a couple of examples. You still are going to have to show it in the claim. So even if you're in a state without exposure evidence required, if you file a workers' comp claim, they're going to ask you for it. Okay, so still providing that linkage, and that 3-part test will be asked for. All right, so regardless of where you live, everybody should be tracking their exposures. So here's an example taken straight out of a state law of what we're talking about, right? The exposure requirements, and again, depending on state, for example, may say that you've been exposed to smoke, fumes, carcinogenic, poison, toxic, on and on. You can see that as an active duty or full-time paid firefighter. Well, in whatever particular state this came from, already we've excluded volunteers, right? So these are the kinds of language that you're going to see in some of the state laws. Here's some other examples. These three are taken directly from state laws. I want you to look at the differences. Exposed to a known carcinogen as defined by what we call IARC. The researchers in the room are very familiar with IARC, but that is the International Agency for Research on Cancer. Now, that agency has literally defined a list of carcinogens, right, that are relevant to firefighters. So if you've not heard of IARC before, you should be familiar with that because it's the likelihood that your state law may even reference it. You have to show exposure to some carcinogen that's on the list of carcinogens from IARC. So you need to know what is in each of your state laws. Here's another one. Demonstrates that he or she was exposed while in the service of the department to a known carcinogen. There it is again from IARC. Exposed to a toxic substance associated with the increased risk of leukemia or cancer, right? So the state laws all are very different. You know that some cover specific cancers, and there's a list, right? So it's not, again, carte blanche for whatever kind of cancer you get. So exposure tracking is key to be able to have your coverage, have your evidence of exposure, file your claims, and actually be successful. Some of the others that you may see, here's a few more examples. We've got smoke, fumes, again, toxic gases are there. The last one actually participated in something where there was involved actual firefighting, so showing that you ever even went on a call. And I can tell you for years, we would get calls from chiefs or spouses saying, you know, my husband has cancer and the department doesn't have any evidence he ever went on a call because they didn't have their data. They weren't even tracking their incident data, right? And so these are the kinds of things where you would go back in old paper logbooks. Well, that's why many agencies have started exposure tracking, right? So that we can look at being able to have, in an easy way, this evidence of exposure. I told you I'd tell you about the Arizona bill. This was very recent. This only happened in the last few months because almost every firefighter with cancer in Arizona, when they filed workers' comp claim, it was being denied. Almost every one of them. And so they had to do something, and they fought to shift that burden of proof that I told you about. And here's what happened. So they went to strengthen the presumption, and where they previously had to show exactly when they were exposed. In other words, their law caused them to have to point to, that's the fire where I was exposed to a carcinogen. So it was very specific. So what they've done is take that specificity away, but they still have to show some sort of clear and convincing, and here's their 6-point test in their law, right? I want you to look at the last one. I know that's a very wordy slide, but though they released or reduced some of the exposure specificity, look at the last one. You have to show that it appears to have had its origin in a risk connected with the employment. What does that mean? You still got to show that it is related to the job, right? And so exposure tracking here still going to be necessary. Not a specific fire, but in general, that you have risk related to the job and you were exposed. So it is important that we understand exposure tracking. And you just heard Dr. Fent and Dr. Siegel talk about the National Firefighter Registry. Well, this is our link to research. So we talk about exposure tracking for your own protection, for workers' comp, to fulfill the presumptions in the law. But we are going to need that exposure evidence if we are ever going to learn more about firefighter cancer. And we just saw that it's still the #1 killer, right? So how do we get better research? The only way that is coming is directly from firefighter exposures. If we don't know what exposures are linked to these cancers for various firefighting groups, then that's not going to happen. And so it is imperative that we all promote exposure tracking across the board. Regardless of what mechanism you use, we must have firefighters tracking their exposures. So again, here's some of the goals for the National Registry, and that is determining or examining that relationship between firefighter activities and cancer, right? So that is going to be incident information. It's going to be how long you were on scene, what job were you doing, what was the duration of your exposure. Is this making sense? We have to have the link of activities to the cancer so that we can learn more. And this is where that exposure tracking comes in. The same thing, and this is taken directly from what Dr. Fent probably just told you, and that is that we're going to look at that across geography. Do you know that we have thyroid cancer clusters in Nevada? We got brain cancer clusters in Florida. Does anybody know why? What are they exposed to? What's causing those? You see, we're only beginning to learn. Why are these things happening? Why are they different? And unless we can gather this information, we won't know. And so the exposure tracking is going to be imperative. We need to know more about our PPE, right? We've got to track the exposures regardless of the PPE, and the ultimate goal, obviously, of reducing that rate so we can bring down that number, that 67% of firefighters who die from cancer. So we have to do better in that arena. I told you there are lots of exposure trackers. As Ed said, we have one. And so I know that University of Miami has one. Washington State has one. California has one. So there are exposure trackers out there. This one was developed with AFG money, Fire Prevention and Safety grants. It is free. It's in the app stores. University of Miami, again, has theirs. Please track exposures. Please promote these exposure trackers in your departments. They become secure career diaries for your firefighters, not just for their presumption coverage. God forbid they need it, but we know it's inevitable that some will right now. So tracking exposures is key. Have them covered themselves where they can download this list, attach it to a workers' comp claim, and nobody then can deny that that was linked. Their cancer is linked to the job. The same thing for research. We've got to be able to better connect. So with that, there's my contact information. I would love to be able to talk with you or your departments more about using our exposure tracker or any exposure tracker that you might have access to. The point of it is, please encourage firefighters to track their exposures, help the research, and help themselves. Thank you very much for your time. Alberto, back to you.
Thank you so much, Dr. Moore. So we have a couple of minutes to do some Q&A questions from folks online and as well as here in the audience. So for those of you that are joining us online, please be sure to use your app and include your questions on here. We'll be monitoring them directly and can ask Dr. Moore about them. So I'll start us off with how do we get firefighters in a practical way involved with using the app? Like, how do we convince them sort of at the local level? What are some strategies we could do?
Well, I think it's going to be important, and it's obvious that, and forgive me, the more tenured firefighters get it, right? Our newer I wasn't going to say older, the more tenured, they tend to get it because you begin to recognize the exposures you've had through time. And if you've ever gone back to try to get information, it is the likelihood of your department having that information is slim and none. We're all learning that. We're getting better, but it's not great yet. And so we have to do better in that. And so the best thing that I've seen is testimony from another firefighter who had a comp denied, a workers' comp claim, a firefighter with cancer who had to struggle, or their spouse who had to struggle to get to the benefits because they kept being denied. So I think we have to tell those stories, as unpleasant as they may be, because we have to make others recognize that this is real. And if you have the "it won't happen to me" or anybody I know syndrome, you're wrong, because everybody in this room knows somebody, everybody online knows somebody who's had cancer. So we have to tell the story.
And similar to that, we often get a lot of questions about sort of confidentiality when they do reporting into the app, and is the information like leaked out back to my department? How can sort of we encourage firefighters to know that the data that they're reporting is confidential and safe for them? Oh,
that's a great idea. And so all of the apps that you would use, well, I'll speak from ours and yours, I know, are secure. If you download the app from app stores, the app that we just put up, then it is secure to you. You are given an ID code that stays with you for life, even into retirement. It is secure on the Amazon web server to DoD standards. Everything is encrypted, both in rest and in transit. Your department cannot access your data. Okay, it is your career diary. And so that is very important. We get it. And we're not just having, in our app in particular, tracking cancer, but behavior health. And I know that you'll hear about the behavior health aspects of, what we're dealing with in the fire service as well. And so it's very important that you have your data, because even for that, if we're talking presumption, we're only now seeing presumptive loss for PTSD, right? And you're going to have the evidence of exposure there as well. So using an app, protecting your own information, holding your career diary. But I will say this, name a beneficiary to your data. We know you don't want the department in it. I can assure you, if something happens to you, they're not getting in it from us. So it is important that you somewhere name a data beneficiary. Isn't that a strange thing to say? And so somebody who can get your credentials to get into your data, should they need it, if something happens to you, okay? So that's kind of a bad thing to say, but it's important because that's how secure the data is.
That's such a great point about having a steward or a proxy just in case something happens that they can access it. Question about international firefighters. So, how about their collection of their data? How can they go about doing it if they're not necessarily in the United States?
Oh, that's great. So our application works in North America. Okay. So US and Canada, all in North America and territories. So if you use the N4's app, it will work internationally, both on iOS and Android. I know that Washington State, it is primarily Washington State. California, I believe they open up to others, and yours, I believe, is open up nationwide. Yes. So I'm not aware we have talked to the UK, and so we'd love to be able to open up the app for them. So we are in talks with other agencies, the Middle East as well, talking with them about opening up the app for them. So we are in talks, but right now, North America.
And I think we have time for one more question. So if you had, for example, blood work done, could you upload it into the app so that you could store it with your exposure info?
Absolutely. So there is a place for you to upload documents. There's also a place for notes. And in the modules within the N4's app, you'll see that there are 5, and then there's an other. So if something really strange, and we get a lot of questions, what if I was exposed to lithium-ion battery fire? Well, that's something you want to document specifically, right? So you might do the fire module and then an other module where you keep some specific notes on those kinds of things. So we have fire EMS, which is going to contain COVID, which you should be tracking too, by the way, COVID. Then we have tech rescue, hazmat is a special module, and then behavior health. So please check those out, download the app, use the app, track your exposure, start your career diary.
Question about if I'm a different type of firefighter. So let's say I'm a fire investigator or I work in wildland. Well, the app, can I use it to record my exposures? Absolutely,
yes. Everyone, dispatchers, do it. Because just the behavior health module for you need that, right? So recording those traumatic events that you're working on dispatching. When there's just imagine what they go through. So anybody, arson investigators, we know that you're not, first of all, donning your PPE like you should, so we've got to do that better. But documenting those exposures. SCBA use is another one. Please, soot on your skin, for goodness sakes. We know these things contribute to cancer or carcinogen exposure. Please document these things regardless of who you are. Paramedics, everybody should be tracking their exposures, because at the very least, every one of you are going out of a fire station where there's diesel exhaust. I know Plum event, I get it, but diesel exhaust, if you're on scene parked for a while and the motor's running, right? So we have to think outside the box and all of the things you're exposed to. Oh, and one more thing, if I may. Just because we say exposure does not mean there was a breach. A lot of people think, oh, if I had an exposure, there was a breach in my PPE, or something went bad, or I didn't follow the rules. No. You are exposed literally on just about every single call, okay? PPE intact. When you're donning, when you're doffing, SCBA on and off, these are opportunities for exposure. So exposure does not mean there was a breach. It means you were in a toxic environment. So track your exposures.
Awesome, thank you. So please join me in thanking Dr. Moore for her time and for her effort and presentation today. Thank you.
Thank you. Thank you, everyone.